Cancer strikes. Hindus, Muslims, Sikhs, Christians, Jews, and Parsis. No one is spared. Cancer is truly secular. It strikes the rich and poor alike, employers and employees, workers and managers. Cancer is truly egalitarian. Cancer strikes at will in every nation, requires no outsourcing. Its reach is far and wide. Cancer is truly global. When cancer strikes, it extracts an economic cost, a pauperization of families because of expenses due to treatment, loss of incomes. At times, loss of the only income earner in the family, a cost to the nation. Because of man-days lost, loss of skilled workers. It also extracts an emotional cost because of the trauma faced by affected persons, families, and caregivers. A physical cost in indefinite pain, undeniable suffering, and often mutilation. 1 in 8 Indians suffers from cancer. Soon, this figure will worsen to 1 in 3. Unfortunately, every 13 seconds, someone somewhere in India dies of cancer. Every 11th bed in a hospital is that of a cancer patient. Cancer does not always happen to other people. Increasingly, it is happening to people we know and care for, and also to ourselves. Does this mean that we should decide that since there is nothing we can do, we are completely helpless? No, not even for a moment. We can all be proactive and take steps to fight and control cancer.
दहशत हुई, घबराहट हुई, लेकिन फिर अपने मन को संभाला कि कोई नहीं, दुख आया है, अच्छी जगह पहुंच गए हैं, पहले इधर उधर बहुत भटके हैं, डॉक्टर को दिखाया, किसी ने सही राय नहीं बताई कि ये कैंसर है, वैसे इलाज चलता रहा। लेकिन जब यहाँ आके पता चल गया तो एक बार को तो दहशत होती है मन में, लेकिन एकदम मन थम गया। फिर अपना ट्रीटमेंट, डॉक्टरों ने बहुत बढ़िया ट्रीटमेंट किया। आज वो उसका रिजल्ट आपके सामने ही है। 3 महीने हो गए इलाज करते हुए। डॉक्टर साहब ने कहा कि ऐसा लगता है कि तकलीफ थी ही नहीं, तो मन को बड़ी तसल्ली हुई, बड़ी खुशी हुई।
We need to remember, cancer is neither infectious nor contagious. When detected early, it is curable in up to 70% of cases. Further, regular screening and annual medical examinations also reduce the incidence of disease considerably.
लेकिन अब तो पूरी तरह ठीक है। क्लास 2 है इस समय। पहले होता था कैंसर के नाम से एक दहशत जैसे हो जाती थी, लेकिन ऐसा कुछ नहीं है। अब तो कैंसर को आप सामान्य बीमारी के रूप में आप ले सकते हैं और ये पूरी तरह से क्यूरेबल है, ठीक हो सकता है। बस यही है कि अगर सही स्टेज पे, मतलब पता चलते ही अगर सही जगह पे डायग्नोसिस कराते हैं आप, तो निश्चित रूप से आप पूरी तरह से ठीक हो सकते हैं।
Even though recent research suggests that many cancers begin in the genes, it is also indisputable that our lifestyles affect their growth and progression. In India, 40% of cancers are tobacco-related, and the rest related to food and lifestyles. Figures which clearly define our responsibility for our health and sickness. Also, it is equally true that only when we are informed, educated, and sensitized can we adopt the right choices, which will help us remain disease-free and healthy. Obviously, the question then is, how do we inform, educate, and sensitize a largely illiterate population with little or no access to modern medicine? This requires a concentrated, focused and consistent effort. To begin with, we need to mainstream health promotion and disease prevention. We appreciate your continuous efforts to redefine strategies, to improve infrastructure, build brands, streamline operations, and even run the nation with energy, dedication, and commitment. Now, we at the Indian Cancer Society request you to similarly devote some of your time, energy, and resources to help us spread this movement. A movement which spearheads corporate and social responsibility for making preventive health a reality in India. Your support will ensure that comprehensive messages on preventive health, promoting cancer education and awareness are created by us and then consistently repeated on all possible channels for optimum impact. The Big C is a collaborative effort initiated by the Indian Cancer Society with the Enable India Foundation to promote cancer education and awareness through a series of public service messages. A project which will only be possible with your proactive support. Remember, we can fight cancer, and you can help us do it.